Hi, welcome to Me Into Health. Today we're going to do some exercises for the anterior cruciate ligament sprain. So these are exercises that you do only if you believe that you have sprained the anterior ligament and not torn it, okay? So you need to have an assessment by a physio who will then assess your knee. I'm also gonna attach a link to a site that can show you what you also can do to assess it, but I strongly advise you to have it assessed properly by a physio, because if the anterior cruciate ligament is torn, you cannot do anything. As a matter of fact, your knee is going to be very unstable. The anterior cruciate ligament is the ligament that holds the tibia at the bone here stable, so it will basically keep on coming forward, yeah? But in any case, you need to have it assessed before you do any of these exercises, okay? So we start with the first two. So for the purpose of these exercises, you will need a resistance band, you will need a pillow that you can roll up to do two exercises, and you need a chair that you need for balance, okay? The first two exercises you can do straight away, even when the knee is all swollen, and you're gonna do these two exercises only until you're able to stand on the legs equally, putting weight on both legs. You cannot do any other exercises until you're able to progress to that stage, okay? The exercises are quite simple. The first one is called the heel slide. So you're coming into a hard surface. So I will roll up here, so you know that this knee is the knee that is injured, okay, which is your right knee. So you're coming down onto the floor and you're gonna do heel slides, okay? So what you're going to do, you're gonna hold yourself with your hands onto the floor. You're bending the foot so that you're bringing the foot to the floor, and you're bringing the heel towards the body and the knee towards the chest. You're sliding it as much as you can, and then you're sliding that leg back down onto the floor. You do it very nice and slowly, gauging, so from the foot, from the leg completely straight, you're starting to slide the heel. Once you're able to put the foot down onto the floor, you're sliding the foot towards you, and then you're sliding it back down. You're gonna do it 10 times. First, you start with one set, and then you're gonna develop to, we're gonna progress to 3 sets, okay? This is the first one. The second one, you're going to do the isometric quadricep, okay? So the injured leg is on the floor, the other one is bent, and you're trying to press the back of the knee down onto the floor, okay? So you're tensing up the muscles of the thigh. When you're tensing up and you're pressing down the knee down onto the floor, you would also feel that the heel comes off the floor. You hold it for 10 seconds, and then you release it, and you do it 3 times. So press the knee down, and you're contracting the front of your quadriceps, lifting the heel off the floor. If it comes off, count to 10 and then release it, okay? So you do these 2 exercises, and then you're gonna progress on to the next 2. Now, on the next 2, grab hold of a pillow, and this exercise, you're only going to do it if your knee doesn't extend completely, okay? So if your leg doesn't straighten properly, then you're gonna do this exercise. So you roll up the pillow, and you're placing the heel just over the pillow, okay? You can lie down onto the floor, or you can just stay here, and then you're basically relaxing the leg, and you're letting gravity straighten the leg. You can also do it on a chair, where you're sitting on the chair and you're placing your foot on the other chair, and then the most important thing is that you just relax the leg. So don't hold on the tension, because then the gravity will do its job, okay? Again, you should be able at some point to get to 2 minutes in this position. You're gonna start with 30 seconds and then you progress to 2 minutes, okay? If this is too much, then you start with just doubling the pillow. You start from here and then you roll it up until it's about 6 inches off the floor, okay? Then you're rolling onto your belly and you're trying to bring the heel towards the bum and then straightening the legs again. You can also relax the head onto the hands. Just bring the heel towards your bum and then relax. You do it 10 times. First you start with 1 set and then you do it for 3 sets, okay? From here, you're going to do the squat supporting yourself on the wall. So you need to roll up a pillow so that you can hold it in between your legs. Your feet are a foot away from the wall, okay? And your feet are hip-width apart, okay? And then you're placing the pillow in between your legs and you're resting the back, the bum, the back and the head onto the floor. Okay, now squeeze the pillow together as you're, so you make sure that the pillow is right in between the knees and you're sliding down. First, you're only going to be able to do a little bit. Stay here for 10 seconds. The head is still against the wall. The whole of the back is on the wall. So perhaps you also need to press the lower back onto the wall. And then you're sliding yourself back up, squeezing the pillow in between all the time. Okay? Then bring yourself a little bit closer when you want to. And then you're going to do it one more time. So make sure that you're still in the sitting position, so you're a foot away from the wall, and then sliding back down. Now press the lower back onto the wall as you're sliding down. Hold it for 10 seconds. And gradually you're going to increase the range, but you don't want to go any more than sitting on a chair, okay? And then you're sliding back up. Again, start with a small number and then just carry on doing it. So you can do 10. First you do 1 set and then you do 3 sets. Okay? Okay, so we don't need the pillow anymore. And now we're going to do the resistance band, okay? So these are stabilizing exercises of the knee. And what you're going to do, you need to place 1 loop of the tube underneath a table. What I tend to do, I need to make a knot and then I place that knot on the outside of the door and then I close the door, so I'm pretty sure that it's not going to move, okay? Okay, once you're there, now this is the thing, you're placing the healthy leg onto the loop about the ankle, okay? So basically what we're going to do now, we're going to do different movements where you're standing on the injured leg, but you're doing movement where you're pulling, in this case, we're pulling the foot away from the door, okay? So make sure you've got, the closer you are to the door, the least resistance, the easier is the exercise. The further you are away from the door, the more resistance you have, the more difficult it becomes, okay? So start quite close. You're pulling the foot away from you. If you want, you can support yourself somewhere. You can use a chair if you want to. You do 10 of these. And then you're turning so that the healthy leg is to the wall, to the where it is attached, and then you're bringing the foot across the body. Okay, now when you're doing the exercises, make sure that the knee is not locked. Okay, so you're not here, you're gently bending the knee slightly. Okay, so support yourself if you need to, and you're bringing that leg across. You do 10 of these, and then you start with 1 set, and then you proceed to 3 sets. Now you're facing, your back is to the table or to the door, and then again, set yourself, balance yourself onto the injured leg, slightly bent knee, and then you're kicking that leg away from you. So this is basically to give strengthening and balancing onto the injured knee, okay? Because all you're doing all the time is basically working on the proprioceptors and stabilizing that leg. And then the last one, which I'm gonna have to turn to show you, is that the injured leg is next to the table. The thing is behind you, and you're kicking that leg away from you, okay? So bend the knee slightly. Okay, once you've done this 10 times, you start with 1 set, and then you're gonna progress to the rest, okay? Now, we are on the, we are here, so we're basically gonna do it again. The next one is, I have to open these because I have to now put it onto the handlebar of the door. And you're placing this time the loop onto the back of the injured leg, okay? Try to make sure that it doesn't go onto the knee, right behind the knee. And then you can support yourself and then just bend the leg slightly and then coming back up. So you're straightening that leg. So that basically you're extending the knee with a little bit of a resistance, and then you're coming back up, straightening the knee, okay? You do 10 of this, start with a set of 1, and then you go up to 3 sets. Now, this is all that you need for the resistance band. The last set of exercises, you need a chair. So you need to place the chair, which is for balance, basically away from the injured leg, okay? So once you're away, so tight. Once you're away from the injured leg, what you want to do, you want to first, you're placing the weight onto the injured leg. And what you want to do with the first one is that you want to transfer the weight onto the edge of the foot so that you're lifting the inside of your arch, keeping the toes down onto the floor, okay? Lifting that healthy leg off the floor. So basically what you're doing with your foot, imagine this is the foot. Sometimes it's just the whole of the foot is flat. You're transferring the weight onto the edges of the foot, so you're lifting the inside of your arch, okay? So you're coming here, lift the leg off the floor, and then from here, you're basically transferring the weight onto the edge of the foot. Stay here for 10 seconds. And then once you're confident that you're doing this so that there's a space on the inside of your arch, then you can start leaning forward. Now you're bending the standing leg. So you're bending the injured leg and you're leaning forward. The more you're leaning forward, the more the exercise is complicated or difficult. So you're leaning forward and then you're straightening the leg and you're coming back up. Once you've done that 10 times, you can repeat it another for 3 sets. And then the last one, you're trying to reach, so again, place the foot so that the foot is on the edge, you're lifting the inside of your arch, and then you're reaching for the chair and coming back out. Reach for the chair come back out, reach for the chair, and come back out. You do it 10 times and then you repeat it for 3 sets, okay? This is all. Just be careful when you do these exercises that you're doing it gradually, you don't do too much. And if after doing the exercises you feel quite tender and tired on the knee, you've done too much or you've done the sets too deep. So you need to just lighten it up a little bit until you can gradually start building up on it, okay? If you've got any questions, please leave the comments below. And then if you like this video, please put a like on it or subscribe to the channel to get more notifications for new videos that come up. Thank you for watching, and I'll see you on the next video. Bye bye.